welcome to Mums at the Table. It is good to have you with us. I hope you're having a good week. I'm Rachel.
I'm Shona.
Now, coming up today, we have got Dr. Wood. He'll be in talking to Fiona, so that's all about women's health. Mm-hmm. We've got Dr. Simone, she's our GP, and Amanda, our dietitian, also talking to Gia. But can I remind you, if you've got questions about any of those, things with nutrition or women's health or just, general practitioner stuff in general, we want to hear from you and we can pass that message on. Well, it is inevitable that your children will fight. There will be rivalry between them, and for me, I think it's, the closer in age they are, the more there tends to be.
Yep.
But tell me about your home growing up, Shona, and the boys. Because we all have it. No one gets out of this conversation.
Well, I don't know. I have seen some families that are not too bad.
Is that just in public?
Oh, well, I don't know, but it used to put me to shame because my kids would fight over a piece of dust.
Yeah.
Because
it's about the power struggle, isn't it?
And I have two children that are very strong personalities in different ways, but they're both very strong. So, yeah, we had a lot of fighting. We had a lot of physical altercations, and they still do fight, even now. Yeah.
And as a mum or as a parent, you just get so sick of it.
I'm the referee.
You get to the point where you don't even care about the argument anymore. You're like, you're fighting, I don't care what, and you sort of forget to take interest in what is important to them. But
yeah, you tend up to be the referee.
How did you help them? How did you referee it, though?
Look, I think if I had my time again, I would do it very differently. We treated the boys as twins, and they were equals, and they
were close in
age, and we did all of that. I don't think I would do that if I had my time again. I would treat them very differently, and I would hone in on their differences rather than trying to keep them the same all the way through. Yeah.
I think my mistake is that in the past I sort of didn't let them have that argument or that fight or that discussion because I was sick of it, and so I sort of cut it short, and that's my mistake because they need to learn to resolve that.
They do.
And so now as soon as I hear it, my question to them is, are you being the kindest possible person you can be?
Wow.
And then they stop and they think, well, not always. Sometimes I see hope that they start to think about what they're doing.
Yeah.
And, I guess my second daughter, I always talk about her, darling, I love you. But she can get offended very quickly and very easily.
Yeah.
And she'll just, at the slightest anything, she'll, really arc up.
Yeah.
And my elder said, Mum, why does she do that? And I said, well, let's think of it like a piggy bank here. When you put your money in the piggy bank, when it gets to the top, what do you get out of it? You get the money out that you've put in. So we need to be filling her with love so that she's full to the top, and then when something comes out, it's in response in a loving way. And I know that sounds cliche and, a little bit funny, but that's the way we've sort of tried to handle it. Don't get me wrong.
It is. It is really hard work.
But you were saying earlier, love languages is a really important thing to know.
You need to know their currencies.
Hey, thanks for joining Dr. Simone and I for a chat. We're talking about skin conditions in our children, particularly warts, because very contagious and a lot of kids have them. Before you know it, their friends got it or a family member has got it and they've caught it from someone or somewhere. So what can we do about them?
Well, look, is it worthwhile identifying the source? Having an idea as to where it may have come from, maybe, but we're not going to say, you gave me the
Eradicate the source.
No. They're so common, and especially at an age where children are passing things to each other, going to swimming lessons and, showers and pools and warm water and those sorts of things. Common sites can be the hands, be that the palms of the hands or even the back of the hands.
Yes.
And they really hurt when they're on their feet, when they're on the feet, especially the underside of the feet, because it can affect the way that children walk.
Okay.
Really painful.
So what would we be looking for that they would be coming home and
so sometimes they can
pain,
if they're saying, look at this, mum or dad, this looks like a little blister or it's a bit raised and it's a bit scaly and it hurts when I touch it. Have a little look at that. Does it look like a wart or not?
Okay. So can it be spread from child to child? You mentioned warm
warm water, swimming pools, those sorts of things.
Right. Some of those things can't be prevented.
Some of those things, and it's with one of those things like it's a part of life. If you identify, you manage in that point in time. It's easier to look after, to deal with a small wart than it is to deal with a big wart.
Okay.
So if you can identify it
when it becomes a cluster.
Yeah, the clusters can be hard to manage as well. So some people find that covering them over can help stop the spread.
Covering them over with a
with
Band-Aid?
like a Band-Aid or something along those lines. There's a heap of stuff that you can pick up at the pharmacy that you don't need a prescription for. So you can get little the ingredient you're looking for is called salicylic acid.
Right.
So that's the ingredient, salicylic acid.
Right.
That's the ingredient that helps to dissolve the skin, because the wart is a little virus that lives at the base of the wart, and it just spits out bits of skin that make a thickened area on top of it. So you want to get through those thickened areas of skin to get down to the base of the wart to kill the virus.
Right. So it's a virus.
Yeah.
The warts are a virus.
If you are not having any success with the salicylic acid preparations, then you can get little freezer-type preparations from the chemist as well.
Right.
They're good entry level, but if they're not working, go and see your doctor, because we've got the good stuff.
Okay.
So most doctors, most GPs have access to heavy-duty liquid nitrogen guns, which can allow us to really get to the root of the wart and freeze it.
And that's when you talk about freezing warts off?
Freezing warts off. That's exactly right.
Does that hurt?
So it hurts. When you're going through the layers of skin that the wart has produced, no, that doesn't hurt at all. It hurts when you get down to the root of the wart, when you get down to the base of it. So you almost want to get to the point where it's starting to sting a little bit, because that's when you know you're getting to the base of it.
All else fails, what happens?
Well, look, so someone, bless them, has done research into this, and you can combine the salicylic acid preparations and the freezing with really good effect.
But if all else fails, go to your GP, get the help that you need, and they'll be able to advise.
Absolutely.
Thanks so much, Dr. Simone.
Salt, and why have we been told to eat less? We've got Amanda here, our nutritionist dietitian. Hi, Amanda.
Hi, Chia.
Now, she's going to talk about salt today, and what role does that play in our bodies?
Yeah, well, salt is actually made up of sodium and chloride, and it's the sodium in it that can be a problem if we have too much of it.
Okay.
But our bodies do need salt for normal nerve and muscle function, as well as to maintain the fluid balance in our bodies.
Okay.
But we do know that having too much salt isn't good for us, and the reason for that is when you eat too much of it, it causes your body to retain excess water and fluid, which puts extra strain. Well, I should say this then increases your blood pressure and then puts extra strain on your heart, your blood vessels and your kidneys, and can put you at increased risk for heart attack, stroke, and kidney disease.
So it could be quite serious.
Yeah, it can.
So what about children? Like, how do we go about children?
Well, it has the same effect on children if they're having high amounts of salts. But what I would like to mention is it is particularly important for babies to minimise the amount of salt and not add it to their foods, because their kidneys are actually immature, so they aren't able to cope with high amounts of salt. Yeah.
So you need to give them less.
Yeah, it's important. Yeah, for babies particularly. Yeah.
Wow. So how can we eat less salt? Like, how does that, what can we do to just reduce the amount?
Yeah, well, a lot of people, adults and children, are eating too much salt. Often people are having double what they actually need. And the reason for this really is that we're eating a lot of processed foods.
Yeah,
definitely.
And
there's a lot of salt hidden in processed foods. So things like canned foods, sauces, bread, some breakfast cereals, cheese, processed meats, salty snack foods, even sweet foods like biscuits and cakes can have a lot of salt in them too.
I've seen that,
So I think probably the biggest tip is to try and eat less processed foods and have more fresh foods which are naturally low in salt or sodium. The other thing is, when you are having packaged or processed foods, is do look at the food labels, choose those that are low in salt, that say they're low in salt or no added salt. You can also look at the nutrition information panel and choose those that have less than 400 milligrams of sodium
400 milligrams
per
remember
100
that.
grams.
Okay.
But also compare the products that you're buying, or look at different products and try and choose ones with the lower
And
sodium.
just don't add more salt to the food you're eating if you are going to have that sort of
That's
stuff.
right. And that's another another good tip. So don't add salt to your cooking, don't add it to your food at the table. But I should say that it does take time for our taste buds to adjust.
Absolutely.
So if you're someone that adds a lot of salt or eats a lot of salty foods, it might be better to just slowly reduce the amount and get used to it rather than doing it all at once.
Okay. And I'll just say there's some fancy salts out there, but we don't have enough time to talk about it. But you were actually saying that it doesn't really make a difference.
No, it doesn't make a difference. So pink salt, rock salt, black salt, they have the same amount of sodium, so they're going to have the same health effects.
Okay. If you want some more tips like this, please follow us on YouTube, subscribe, or Mums at the Table Facebook group, or mumsatthetable.com. See you next time. Bye.
I'm so glad you've joined us for this next topic. We're talking about incontinence post-pregnancy. Now, it might be something that we laugh about with our girlfriends, but it happens, and
it's often not talked about either.
Yeah.
So, but it's good to talk about it. So, firstly, it happens. Let's explain. So, when a baby comes out of your vagina, it stretches your pelvic floor muscles in a way they aren't normally stretched.
Yes.
And sometimes those pelvic floor muscles, they are important for maintaining your bladder control. So what can you do beforehand and what can you do afterwards to sort of help reduce the risk from this happening? So firstly, it's good to do pelvic floor exercises. And it's not like something you just do for like a couple of days and then it's all right for the rest of your life.
Right.
Pelvic floor exercises are like a commitment for life.
Okay.
And you should be doing them all the time.
It's like brushing your teeth.
Pretty much, that's right. So what are pelvic floor exercises? Now, as a trial, what you should do is when you're sitting on the toilet and the urine's coming out of you, try and stop the urine from flowing.
Right.
And if you can do that, that's contracting your pelvic floor muscles, and that's really good.
That's how you know that's the muscles that you should
That's
be
how, exactly
and
right.
You don't do this all the time on the toilet because you might get a UTI.
Correct. So that's I was going to get there, but you beat me to it, which is good.
Right.
So don't do that as the exercise. That's like the test. Maybe once every 6 months you just do to make sure you actually can do it. And not everybody can actually stop the flow of urine, but if you can actually get your head around which muscles to contract,
Right.
that's really important. If you're really having trouble working it out, you can see a pelvic floor physio, and there's a bunch of them around who are specialised in helping you with these exercises. So, firstly, work out what what muscles you need to contract. Next, this is what a normal set of exercises includes. You do 10 quick ones. I'm going to just imagine my hands are pelvic floor muscles, right? So you do 10 where you go squeeze, relax, 10 of those. Then you have a break. Then you do 5 where you hold it for 10 seconds.
Right.
And then you relax for 10 seconds, right? Okay. So the whole thing takes a couple of minutes, right? And
we can do them right now.
that's right. No one knows when you're doing them. You can do them anytime, right? So you need to develop a habit of doing them regularly. And so you're going to set up some little cues for you. Like if you watch a lot of TV, when the commercials come on.
Or even at the traffic lights.
Traffic lights.
So these help.
There's just things to just like fill in the time, but do it regularly and become this regular habit.
So what if you have this problem? What if you have this problem? What can you do?
So firstly, go and see a pelvic floor physio.
Right.
So firstly, we're going to talk about just with labour, right? So when the birth happens, often afterwards, there is some leakage for a couple of weeks while your bladder's kind of recovering from the process.
So this can be expected.
That's right. The part of your bladder that senses when the bladder is full, that gets really stretched when your cervix dilates. And so as it comes back, it just takes a while for it to recover because it's been a bit of a shock to it. So but after a few weeks, things are normally returning to normal.
Right.
Regular pelvic floor exercises after the baby's born, same sort of process as we talked about, same set of exercises, do them regularly. If you're still having problems long term, you need to go and see a pelvic floor physio to help you. And there are very rare that you might need some, other type of intervention to help with this. But it's a very common problem.
Yeah.
It's not often talked about in our society because it's kind of a bit embarrassing.
Well, us girls laugh about it. So thank you so much, Dr. Wood, for those tips, and I hope that's helped you. Keep it locked right here at Mums at the Table.
So have you ever had conflict between other mums?
Oh, look, I don't think any mother can ever say, once they've had children, that they've never had conflict. You've got it at mother's group, you've got it between friends, church, or anywhere. Where there's children,
where
there's
there's
going to be
differences.
conflict.
Yep. Okay, so what do you then do to sort of resolve that and go about, fixing that connection?
Well, I think for me, recently, it's been about prayer. It's been about asking for forgiveness for myself, understanding the other person's point of view, seeing that, again, with conflict, that there are different sides and different points of view. How about you?
Yeah, for me, it's about actually confronting it. So it's very easy to put it in the, that's too hard to resolve right now, let me just deal with my family. And I have had instances where I have had to sort of go to them and say, look, I'd really like to resolve this because that friendship is important to me, but I need to invest in it as well. And I agree with you, the forgiveness, you know, you can think about it and stew in it, but forgiving them, whether they want it or not, is actually very healthy and helpful for us.
Yeah, yeah. And there's a really nice resource on our website, isn't there?
Yeah, look, we've got our mums group, our Facebook. It's a private group, Mums at the Table. It is a safe place, so if you'd like to come and join us there, you can ask mums all sorts of questions. And it's a place where you can, you know, do that, I guess, in confidence and safety with each other and have that community that we're all looking for. That is it from us today. We've enjoyed having you with us, but we will see you next time with more great topics.